Okay, so I want to get this out of the way, and then let's see if we can if we can hammer out a few videos, because I'm tired of just arranging everything. Okay, I think I'm ready to start. All right. Hi, this is Dr. David Ejibade. I want to talk to you about a couple of topics on autism, and so we'll start again because this is going to be like a series of like 2 minute videos on different aspects of autism. So, hey, so sometimes parents ask, what should I do to prevent my next child from having autism? For instance, if they've had two. I know of a particular mother who had twins, and they were developing normally, and then they regressed. And at this point, I think they were traveling to the US, and so they had to have their hepatitis vaccines. So she gave them the vaccines, and since then, according to her, the autism started with both her kids. They lost all speech and they had started displaying all the behaviors of autism. So she determined or decided that her third child would not have any vaccines whatsoever. Well, guess what? The third child, which was a boy, still had autism. And so she's dealing with 3 kids with autism. Now, obviously, there's a genetic factor there. Could be environmental as well. And it's always the two combined. And there could have been a stressor which was not a vaccine. So we're not so sure about what happened. But nevertheless, here are some things that I would strongly advise every parent in order to have a healthy child and a well-developing, well-adjusted, healthy, growing up child, especially for the first, from pregnancy to the first 3 years, because it's around that 3rd year that seems to be the crucial point. If your child is normal until the 3rd year, you're pretty sure she or she is not going to develop autism. One, you got to take, the pregnant mother has to take ample amounts of vitamin D. For Black women, I would say nothing less than 10,000 international units. It is not harmful. You would have to take millions for it to be harmful. Well, that's maybe not millions, but the Mayo Clinic says that 60,000 international units a day is what seems to be the upper limit for you to develop toxicity. Well, the regular amount or the recommended amount is about 600 international units. So 60,000 is plenty. All right, so that's one. You got to take zinc, especially for boys. It has to do with the testosterone development and all that. So you want to be sure that you're taking at least 50 milligrams of zinc a day. Thirdly, you want to make sure that you're taking your folic acid, with one caveat: you've got to stop taking folic acid after the first trimester. That's right. After the first trimester, you stop folic acid. Research and people who know say that once you keep on taking high doses of folic acid after the first trimester, there's a huge risk of developing what is known as undermethylation, which can result in autism. So those 3 things. You want to take vitamin D. I would say for Black women, nothing less than 10,000 international units a day. You want to take zinc, 50 milligrams. You want to take folic acid, but stop after the first trimester. I would also strongly advise you to take vitamin C. I would say at least 2,000 milligrams a day throughout your pregnancy. It's amazing what a simple thing can do. And take powder, don't take capsules. I always prefer powder because you can put powder in a bottle or drinks and you can drink it throughout the day. You don't want to take it at once because your body just takes a little bit, does the amount it needs at that time, and then it gets rid of the rest. So you want to avoid taking just bolus or large amounts of vitamin C at once. Not that it's going to harm you, it's just like that you're going to waste it. And when your body needs vitamin C, it's not going to have it because you took it once and then you got rid of it. But if you take throughout the day as much as possible, you'll get much better results. So I hope that serves you. On to the next topic. All right, let's talk a little bit about an overview. I want to give an overview of our approach to autism, and it's a 6-month approach. The first 4 to 6 weeks, we're dealing specifically with cleansing. So think about a plumber. Everything is stopped up in the toilet. You want to flush all that out, get all that stuff out and get rid of it. That's really all we're doing. Now, for some kids, you see dramatic results. For other kids, nothing much. I really don't care. The bottom line is that I want to make sure that the parents are seeing that their child poops at least twice a day. If we can establish that, if we can achieve that 3/4 of the time, that we are in really, really, really good shape. And so that's where I want to start with. Now, after that, hang on. All right, so for the first 4 to 6 weeks, that's what we need to do. We want to get all that stuff out. And as much as possible, kill, destroy, remove toxins. We want to remove chemicals. We want to remove parasites. We want to remove bugs, whatever it is. We're just trying to get all that out. Now, after that 4 to 6 weeks is over, and I'm satisfied that and you're going to fill out forms and all that. So when I see the forms and I see that you've been consistent and we have at least 75% achievement of that 2 poops a day, then we can move on to the next stage. The next stage we are looking at beginning. It's called the refeed and reseed stage, and a repair stage, because we're going to refeed, we're going to reseed and repair. Reseed means we're going to start putting in the good bugs, the probiotics, the high potency, high population probiotics to restore the gut balance, to put the good guys in and to fight off any other remaining bad guys. And we have to refeed them because these good guys need food. So we're going to also give prebiotics, which are like fiber. I use a specific brand of psyllium husk. So we give psyllium husk. It's a powder. You can sprinkle it on food and give that along with that. We also want to repair, because this is a time, for the most part, there's leaky gut, there's inflammation in the gut lining, and therefore there's a lot of porosity or increased permeability, so that food, undigested food, and bugs can still escape into the bloodstream. The fact that we've been able to clear out a lot of that stuff does not mean that those holes have been plugged as well. So we have to deliberately plug that. So we address inflammation, omega-3s, again, specific brands of omega-3s, and also we use specific nutraceuticals that specifically repair the lining of the gut. And we go on that for another 2 to 3 months. In the process too, if needed, and many times we're going to be adding this into it, are enzymes. Because what we know is that kids in general tend to have problems with digesting casein, gluten, and soy. Those specific proteins seem to give the most trouble. So then give enzymes that help the kids break these up. Even if they don't need them, it's not going to cause any harm because they don't affect the body in any way. So we go on for the next three or so months. And then as we proceed, and based on the feedback, we now also decide to focus on the brain, which is obviously where the problem really is. Now, we can't go directly to the brain because of all these other things going on. It's kind of like trying to change the upholstery of your living room furniture when the ceiling is still leaking or the roof is still leaking. So that wouldn't be very wise. So we want to focus on blocking the leakages and blocking the inflow of all the toxins and chemicals. And then when we're done that, or to a certain extent, we can now begin the repair of the brain. Usually by this time, a lot of improvement would have been seen by the parents. So there you go, 6 months. Usually it takes about 2.5 years to really treat autism using the biomedical approaches. But I have realized that working with parents has been really tough because it's hard for them to get the money needed to buy all these nutraceuticals. I mean, I usually just give my time free of charge to guide them through the process. I don't even charge for my consultation during the process, especially for those in Nigeria. Now, if you're in the US or in the UK, yes, I will charge you. But for those in Nigeria, I let them off easy. So that's it for the process. I hope you understand what I'm talking about too. It's a 6-month process where we really hit it hard. If you have any questions, please feel free to reach out to the rest of my team. Okay, let's talk about FMT, fecal microbial transplant. Fecal microbial transplant. In my opinion, that seems to have been the most successful treatment for autism I have seen yet. And I know there have been different kinds, you've seen different diets and different approaches and all that, but where it comes to fecal microbial transplant, that seems to have done it the best. And basically what fecal microbial transplant means really is exactly as it sounds. You're taking out the feces of a normal child or adult that has all the bacteria and the good bacteria, and I mean, just the whole ecosystem with the poop and all that, and then cleaning it up to some degree and put it in the child with autism, either through the mouth in the form of capsules, obviously it's all cleaned and it's well taken care of, or using it as an enema through the rear and some suppositories as well. So you're trying to reseed, basically you're trying to reseed the gut. And the studies have been done in Arizona, and it's almost, I would say, close to 90% effective. Obviously, you need a lot of expertise to do that. That is not available in Nigeria and most third world countries. So that is not an option. So what we do is something similar to that. Again, it's about taking care of the gut. Yes, the brain has issues. Yes, the immune system has issues. But if you deal with the gut first, the other issues, even the structural issues in the brain, the connectivity issues in your brain, seem to diminish. Now, they may need special attention later on, but if you deal with putting the right kind of stuff in the gut, the problems in the brain and other parts of the body seem to improve. So fecal microbial transplant, if you have access to it, I don't know too many places. I know there's a place in the UK, I know there's a place in Germany, and I know there's a place in Mexico that they're trying to do that. And there's usually a very long waiting line. I would strongly suggest that if you have seen any problem wrong with your child, you want to do something about it as quickly as possible. So even if you are going to eventually do the fecal microbial transplant, I would strongly suggest that you address this one first. I mean, you take our approach first. I know that's kind of self-serving, but I know what I'm talking about. So that's it for that. All right, let's talk about the immune system and autism. Now, when I was in medical school, the only thing I ever heard about autism was that it was an autoimmune condition that was attacking the lining of the gut of kids with autism. That's it. That's all I heard. And at that time, I can remember thinking to myself, how weird. What does a brain condition have to do with the immune system and the gut, for instance? I mean, I thought everything was about the brain. That was our neurology class. And so anyway, I probably was half asleep during that time anyway. So I was like, okay, well, I'm not going to run into any kids with autism, probably. And it's probably a white person's disease anyway. So there's nothing, I don't really have to learn this. I just have to cram the information and then just we go to the exam hall and regurgitate it. And that would be it. Well, fast forward 25 years later, and here we are. I'm steeped in autism and studying it like crazy. And it's one of the most interesting topics. And I know interesting is not the word that you would prefer, especially if you're a parent of a child dealing with autism. But the good news is that there is so much that we know about it now, that there are so many options to addressing it in a detailed, systematic, straightforward way that I think we can really get a lot done. So back to the immune system and autism. What does the immune system have to do with autism? A lot. Starting from pregnancy, there are some conditions in autism that are attributed to what is known as MIA, maternal immune activation, in which the mother, for some reason, her immune system is attacking the growing and developing child's brain and gut. And it doesn't kill or destroy, it just deregulates certain things and affects the child's normal brain development. And we see the signs of this right from the womb. And there are subtle signs. These aren't things you can catch on an ultrasound or an X-ray, but they're there nevertheless. And we see signs in the brain. The specific aspects are the brain, the cerebellum, development of the cerebellum, development of what is known as the amygdala, which is like the fear center, parts of the frontal brain. And I think the fourth one is the connecting fibers between the two hemispheres. So those are the four main areas that you see changes. And again, they are not readily observable on the regular MRI or CT scans. But also you see that the child's immune system, for some reason, the child's immune system is attacking things in the gut, structures in the gut, especially the lining of the gut. And then beyond that, because the gut is affected, there is what is known as leaky gut. A leaky gut, in simple terms, mean that there's increased permeability, food content, partially digested food particles, bugs, bacteria, even parasites are able to breach the defense, the barricade that is preventing all kinds of things from getting into the bloodstream. Because the barricade or the barrier is not working like it should, many of these substances are able to get through and into the bloodstream. Once they get into the bloodstream, because the immune system of any human being does not want, there are certain things it should not be allowing into the bloodstream. So the immune system in the bloodstream, the immune cells in the bloodstream mount up what is known as an inflammatory response. So they begin to attack these particles that are coming into the bloodstream from the gut. It's not like a shock, systemic shock kind of thing that you see it in the individual. They just create subtle changes, subtle sensitivities, subtle, even in terms of behavior and emotions. These inflammatory particles, inflammatory chemicals are acting on the brain, acting on the immune system, acting on the endocrine system, creating behaviors and speech problems and social problems that you see on the outside as abnormal. So one of the key things to do when it comes to treating autism is to reestablish in that barrier, building on the healing and repairing that barrier so that it doesn't allow all this stuff to get into the bloodstream like as it was doing before. That's one of the key things you want to do when it comes to autism. You got to reverse leaky gut. Once you can do that, you can go a long way towards helping the child or the individual with autism. Speaking of leaky gut, we also think about the leaky brain as well. It's another term that we're beginning to find out, where the barrier between the brain and the bloodstream, called the blood-brain barrier, is affected, is compromised, is breached by all these chemicals that are being leaked into the bloodstream, the immune system attacking and going haywire, doing what it's not supposed to be doing because it's been triggered and attacking even normal cells. Well, that affects the blood-brain barrier as well, and therefore letting chemicals into the brain, causing inflammation. So what starts in the gut certainly does not stay in the gut. It becomes a widespread thing. So it's super important for us to improve the health of the gut and the brain by addressing these barriers. That's it for now. I want to talk about sensitivities and the brain and autism. So sensitivities like sensitivities to light, to sound, to taste, to touch. Certain textures don't go too well with kids, to smells. And this, in the general term, is sensory overload, and different senses are affected in different kids. Some kids just don't want to be touched. They just feel very uncomfortable when they're being hugged. Others want to be hugged. Others want to be squeezed. In the whole spectrum. So there's one particular syndrome called Irlen syndrome, where it's known as a visual, I think it's visual sensitivity, sensory perception syndrome. It's named after a lady called Helen Irlen, who's become a good friend, mentor of mine. And basically it has to do with light perception. As you know, 70% of all the input that comes into the brain comes through the sight, through the eyes. So a lot of things, if there are things that are going on, if kids are hypersensitive in several different areas, if you address the sight, it can go along towards quietening that noise. And so she found out that even with autism and other things like ADD, ADHD, that simply by putting on what are known as certain filters, certain eye, certain tints, whether it's blue or red or pink or purple, she tests you first, and then she finds what tint of lens works, what color works best for you, and then you use it for a while. And she's found out that it helps not just with people who have light sensitivity, but also people who have things like hearing sensitivities, touch pain sensitivities, and so on and so forth. That's gone a long way towards helping such individuals. So Irlen is IRLEN. It could be a game changer for a certain sect of people. So I would suggest that you give that a try. So that's it for now, and keep staying in tune for more videos.